there, my dear listeners. My name is Nath, your antimicrobial steward, and I would like to briefly talk about drug resistance and antibiotic or antimicrobial stewardship, with emphasis on the frequently asked questions. So the first question I would like to respond to is, what is antibiotic resistance? What is AMR? Now, AMR occurs when bacteria change in some way, in one way or another, that reduces or eliminates the effectiveness of antibiotics and other chemicals that are designed to cure or to prevent the infections they cause. Now, the bacteria in such circumstances survive and continue to multiply or proliferate, causing more harm. These bacteria can also share the ability to resist the action of antibiotics with fellow bacteria. In other words, they are promiscuous in nature, and that further complicates our ability to treat the infections that are caused by such bacteria. Now, this problem is one of the most pressing public health threats in the world today, and it affects our ability to effectively treat or manage bacterial infections. Next, I would like to tackle the question, why should I be concerned about antibiotic resistance, about AMR? Now, patients or people who develop infections that are caused by resistant bacteria have an increased risk of hospitalization. Now, apart from that, there are high chances of such patients being transferred to intensive care units or high dependency units, and by extension, they are likely to incur higher hospital costs, and they are likely to stay in hospitals longer, and they also tend to have an increased or higher risk of death. In addition to that, antibiotics can eliminate good bacteria from the bodies that we subject them to, and this increases risk of developing infections such as Clostridium or Clostridioides difficile diarrhea, which is very difficult to treat or eradicate, and it can have far-reaching consequences in our patients. It majorly affects the gut, leading to extensive diarrhea, and it's common in residential facilities and healthcare settings. Now, through the elimination of the friendly bacteria, we can also end up with vaginal thrush in the female population and oral thrush. Both are fungal infections. Oral thrush can affect both male and female patients. Now, apart from that, I would like to touch on AMR, antimicrobial resistance. Now, AMR is not just a problem for the person with the bacterial infection. Drug-resistant bacteria are able to spread very widely and to cause illnesses in other people in the community as well. Now, the next commonly asked question I would like to tackle is, what is antibiotic or antimicrobial stewardship? Antibiotic stewardship is a term used to refer to interventions or a set of programs executed in a coordinated fashion that are designed to improve the use of antibiotics so that AMR or antimicrobial resistance is checked and that treatment options are preserved for future generations. Now, these programs have been proven to cut costs of treatment, to reduce infections by Clostridioides or Clostridium difficile, and to reduce the use of unnecessary antibiotics. Next, I would like to respond to the question, how can I prevent the spread of drug resistance in my facility, in the institution in which I work? Now, there are several things that you and I and other staff members in your facility can do. These include use of antibiotics for their appropriate dose and duration of therapy. Now, we should also learn to choose antibiotics wisely to reduce their unnecessary use. In other words, we should only prescribe antibiotics when they will be beneficial to the patients we are treating, even if the patients or the residents ask for the same. Apart from that, we should target the likely infection-causing organisms, also known as pathogens, as specifically as we possibly can. In other words, we need to know the common bugs in our hospital environments so that we do what we call directed or targeted therapy. We should also avoid overlaps in our antibiotic prescriptions. We should avoid adding sugar to honey. In other words, we should avoid using 2 antibiotics tackling the same bacteria, especially in the mild infections. Now, apart from that, we should never ever treat viral infections such as the common cold or influenza with antibiotics because they do not work in such circumstances. Antibiotics do not treat viral infection. Apart from that, we should also assure all medical providers, in case of uncertainty, and ensure they are knowledgeable about the appropriate use of antibiotics or antimicrobials. We should also enhance their knowledge on AMR, antimicrobial resistance, and we should also enlighten them on the adverse effects of antibiotics that we use in therapy through continuous education or continuous professional development. And let's always emphasize familiarity with resistant strains in our hospital or in our region. I urge you all, dear listeners, to rationally use these finite resources that we have so that we don't drive the emergence or development of antimicrobial resistance. Let's be good, responsible stewards. Let's drive forward the agenda of judicious use of antimicrobials so that future generations have treatment options when faced with infections. And if this video helped you in any way, make sure you give it a thumbs up and subscribe to my YouTube channel. The best is yet to come. Thanks for watching and have great antimicrobial stewarding. Thank you.